Okay, so before we start, I would like to show you a video of how disease prevention and hand washing is important in healthcare facilities. In this presentation, I will explain what infection prevention is, why is it important, how it protects both workers and patients, and what can happen if proper infection control is not followed. What is infection prevention? Infection prevention refers to the action taken to stop the spread of diseases. This includes proper hand washing, correct use of personal protective equipment or PPE, safe handling of medical equipment, and keeping the environment clean. In hospitals, infections can spread very fast if proper guidelines are not followed. A simple mistake such as forgetting to wash hands before touching a patient can lead to serious health problems. Healthcare workers are trained to follow strict rules for cleanliness and safety. These rules help reduce the risk of infections inside healthcare facilities. Also, known as hospital acquired nosocomial infections. What happens if infection prevention is ignored? If infection prevention is not followed, the results can be very serious. Healthcare workers can get sick or even die. Patients can suffer from infections that delay recovery. Hospitals may experience outbreaks that can force units to close. Trust in the healthcare system can also decrease. These consequences shows that infection prevention is not optional, it's necessary. Common infection prevention measures. There are many ways healthcare workers prevent infection. One of the most important is proper hand hygiene. Washing hands before and after patient care is the simplest but most effective way to prevent infections. Other method is using PPE such as gloves, masks, gowns, and face shields. This protect healthcare workers from harmful germs. Cleaning and disinfecting medical tools is also very important. Equipment that is not cleaned properly can spread infection. Isolation is also practiced for patients with contagious diseases. This helps prevent infections from spreading to others. All of these practices work together to create a safer environment inside the healthcare facilities. Good day, everyone. I am here today to talk about an important topic in healthcare, which is the importance of infection prevention for healthcare workers. Healthcare workers are always exposed to different types of bacteria and viruses every day. They care for patients, handle body fluids, and work in close contact with people who may have serious infections. Because of this, infection prevention is not just a rule, but a very important responsibility in the healthcare field. In conclusion, infection prevention is one of the most important responsibilities of healthcare workers. It protects health workers, saves patients, and prevents diseases from spreading in the community. Simple actions like hand washing, wearing PPE, and following safety rules can make a big difference. As future healthcare professionals, we must remember that preventing infection is just as important as treating disease. Thank you for listening, and I hope you learned the importance of infection prevention today. Infection prevention is not just about keeping things clean, but about protecting lives. Why is infection prevention important for healthcare workers? First, infection prevention protects the healthcare workers themselves. Healthcare workers are exposed to blood, body fluids, and infected patients. Without protection, they can easily become sick. If a nurse or a doctor gets infected, not only their health is affected, but they may also be unable to work and care for patients. Second, infection prevention protects patients. Patients in hospitals have often weak immune systems. If a healthcare worker carries germs from one patient to another, it can lead to infections that can slow down healing or even cause death. Infection prevention protects the community. When infections are not controlled in hospitals, diseases can spread outside the hospital and into homes and communities. This can cause outbreaks and endanger many lives. Fourth, infection prevention helps reduce medical costs. Treating infections is expensive. When infections are prevented, hospitals save money and patients avoid paying for extra medicine and treatments.